Hi, my name is Michaela. I'm going to be your student nurse today. Can I verify your name and date of birth?
Taylor Ross, 11496.
Okay. Taylor, are you feeling any pain today? No, you're not anxious or anything? Okay, perfect. Do you know why you're here?
Because I got a new medicine.
Yes, so the doctor had prescribed you a beta blocker. Essentially, the beta blocker is so that we're going to be able to monitor your heart rate. It runs a little on the higher side, so we want to make sure that it comes down a bit into normal range. And when you go home, we want to make sure that you can monitor that it's not falling below the normal range or too low. So what I'm going to do today is I'm going to teach you how to take your radial pulse, so when you go home, you'll be able to take it 30 minutes after you take your medicine, and then you can tell me what the normal ranges are so you know when you're at home when or if you should come back in or call if you have questions.
Okay.
So would it be easier for you to show me or tell you on how to take your radial pulse?
You could just tell me, and if I get confused, you can show me.
Okay, we can do it together if that would work for you. Okay, so why don't we put your palm side up, and you're going to take your first and your middle finger, never your thumb because you'll have a pulse in there as well, and it can give you an inaccurate reading. You're going to follow down the thumb side to the groove on your wrist, and then you're going to do a little slight pressure. Do you feel it?
Mm-hmm.
Okay, so what you're going to do is you can take it for 30 and multiply it by 2. You'll just look at any clock or a watch if you have one, and it looks like you do. Or 60, but we'd rather you take it for 60 just so you're getting an accurate reading. So why don't we go ahead and do that right now? Okay, so what did you get?
81.
Okay, so 81 does fall within the normal ranges. The normal ranges are 60 to 100. So that's one thing I definitely want you to be able to remember when you go home. And then if you have any questions, you can call or let anyone know. Do you have any questions for me right now?
No.
Okay, so before you leave, I want you to be able to tell me how you're going to take your radial pulse.
I'm going to use my two fingers, not my thumb. And then I'm going to feel this groove and apply a little pressure until I feel it pulsing. And I'm going to count for 60 seconds, 30 minutes after I take my medicine.
Great. And do you know what the normal ranges are for your heart rate?
60 to 100.
Okay. Is there anything else I can do for you before you leave?
No.
Okay, great.